Hello everyone, my name is Stephanie Ramirez, and today I will be discussing my topic on hospitals, public versus private, alike in all unimportant respects. My thesis is in regards to considerable debate whether or not public and private hospitals operate and provide the same level of services. To answer Graham Allison's question, yes, they are alike. Since both the private and the public hospital's mission is to provide the appropriate healthcare to all individuals, and in order to prove that they both run efficiently and the same, I will be utilizing Wilson's dichotomy, Frederick Taylor's 4 principles of management, and Weber's bureaucracy. With Wilson's dichotomy, Wilson stated that administration lies outside the proper sphere of politics. Therefore, with the example of the private and public hospitals, it is the doctors' and nurses' job to administer and provide the medications as needed to their patients. With other examples of agencies like the CDC and DEA that collaborate with hospitals in order to regulate any misuse of medications, they are not allowed to interfere with any of the hospital's procedures as freely as they want. There is a process for everything, and any agency needs to follow it. It is the doctors' and nurses' job to oversee these medications they are providing to their patients and document every usage of it. So the DA cannot just randomly walk into any hospital and do some random check-in for their records. When and if the DA gets involved is whenever there are some red flags. So if there's not abuse in medication being recorded, then there is no need for them to go in and do some random check-ins. In regards to Taylor and his scientific management that consisted of 4 principles, this ensured that hospitals, both private and public, are able to function properly. So they both are able to have that appropriate trained staff, from anything from doctors to nurses to certified LVNs, again, and also having them know how to follow in the rules and procedures of the hospital. Anything from procedure that is, documenting every fall, every step that they take, any type of medication that they're given, as well as documenting their meals that are consuming every day, and documenting who is going in and out of the rooms, during visitation hours. Also by having their rule of authority. So the doctors being their boss, being the authority, and then having, the LVNs, the aides, and nurses, charge nursing to all report back to the doctors. So every documentation they make, everything gets reported back to them. Also, Taylor focuses on having that supervision. Now, although we or some of us may or may not like having someone, monitor our work or having somebody look over our shoulders here and then, this is actually very important within this field because this actually is benefiting for them by having an extra set of eyes. So if you have a nurse that's dealing with a difficult patient, your charge nurse can always be that extra set of eyes for them, to see that the patient is being treated correctly and appropriately, depending on the case, and the severity of the case. And in that way, everything is being done correctly and getting reported back to the doctor correctly as well. And lastly is Max Weber. And with Weber, we see a lot of the similarities as well from Taylor's scientific principles of management, such as the division of labor, the hierarchy of authorities, so everybody still having that one manager. The nurses follow their doctor's instructions, the LVNs follow their nurses' instructions, and the nurses having to also follow their church nursing supervisors of the night instructions. And again, everybody following rules and protocol. However, Weber does also kind of focus more on what he calls hiring and promoting based on merit. So both private and public hospitals have to have, in order for their employees, let's say for doctors, in order for them to emphasize more on taking patients with heart problems, they need to become cardiologists. They have to have that specific certification, that degree that doesn't only tell the hospital they're certified, but they're going to be able to tell their patients that this is their area, they are specified in. And those individuals with heart problems, as well as pediatricians. They're not just doctors. They have their specialty with children. So they have to have that type of degree in order for them to be able to move to a higher standard. And lastly, Weber also likes to focus on having every person, every staff, every employee, including doctors, including the authority, have consistency and accountability for their actions. This includes within both the public and the private hospitals. Documentation, very, very important again. Being able, if the nurse is charting, if they are taking down that this patient, diabetic patient, took the insulin, whether they gave too much, whether they gave too little, whether they weren't giving anything at all. If they, by mistake wrote down that they gave it to them and they didn't give it to them, they have to be accountable for their actions. That's why within the public and the private hospitals, documentation is one of the most important things in this field, because any question that the doctor may have, any question that any special doctor may have, it goes back to the documentation that the nurse is taking. Now that concludes my presentation. Thank you so much for taking the time and going over my presentation. Please feel free to leave me some suggestions or comments on how else I can expand my thesis, or any type of comments that you may want to add. Thank you again, and you guys have a blessed day. Bye-bye.